Hello everyone! Today we are going to demonstrate how to submit a revalidation application request for an Organizational National Provider Identifier or NPI, using the Provider Enrollment and Management System known as PEMS. An organizational NPI can enroll with TMHP as a facility or a group. Information that is required for the various provider types that use an organizational NPI will vary. If you have questions specific to your provider type's enrollment requirements, reach out to TMHP for assistance at 800-925-9126. Today we will focus on what fields need to be completed in PEMS to successfully submit the revalidation request. Right now, we are at the PEMS dashboard. I would like to start off by pointing out Provider Management here at the top of the page. This is where all your enrollment records are kept for NPIs that you are an administrator of. If you want to access an enrollment record but don't see it on the dashboard, call TMHP at 800-925-9126 for help getting linked to your NPI so that you can view it on the PEMS dashboard. You will notice that there is a field that gives us our revalidation due date. If a provider is within 120 days of this date, a revalidation request can be submitted. In the upper left corner, we see Request. This area displays requests that are in draft or that have already been submitted. After we submit our revalidation request, this will be the area where we can view the status of that request. To get started, click the three dots on the right and click View for the NPI that you are revalidating. After opening this record, click Edit Enrollment Record in the upper right corner to initiate the revalidation request. Here we see that the only two options are to create a request for a revalidation application or to update your email address. Remember, these will be your only options if you are within 120 days of your revalidation date. To get started, click Create Request for Revalidation. We have now successfully created our enrollment request, and there are a few things that I would like to point out before we continue with our demonstration. In the upper right corner, you will see the request number for your revalidation application. If you need to exit the request and finish later, you can search using this request number. You can also search by the provider's National Provider Identifier. On the left, we see that there are 12 tabs. You will need to review the information on these tabs to revalidate. However, there are two exceptions. For an application where an organization is revalidating, the services provided and the attachments tabs are not required to submit the request. Although, be sure to use the Attachments tab if you need to attach a document. For today, we will skip the Services Provided tab, since it is not a requirement. Once a tab is completed, it will reflect a blue check circle. Our goal for the revalidation is to obtain blue check circles on each tab where information is required to be entered. The first tab that we will look at is the NPI Taxonomy Information tab. This tab will display your information directly from the National Plan and Provider Enumeration System, or in short NPES. If nothing is displayed here, click Refresh Information in the upper right corner. You will now see the taxonomies that are tied to your NPI within NPES, along with your name, NPI number, NPI type, which will be organization, and other information. After clicking Refresh Information, the blue check circle should be reflected. Next, let's click the Provider Information tab on the left. In this tab, the organization's name should be reflected. If the name is not correct, make the appropriate update. The name listed here will be the name that populates under W9. There is also a field for a primary and secondary email address. This email address is used to provide you with enrollment notifications. Once you enter an email address in this field, it may display as unverified in red, like we see here. To verify an email address, click Verify Email on the right. This will generate an email to the address listed. Click the link within the email to verify the address. Then go back into PEMS and click Save at the bottom of this tab. The status will update from Unverified to Verified, and you will now see the blue check circle on this tab. Next, let's click on the Licenses, Certifications, Accreditations tab on the left. To add a license, certification, or accreditation, click the Add Licenses, Certifications, Accreditations button within this tab. For today's demo, we will add a CLIA certificate. Start by selecting Accreditation from the drop-down. Then for the issuer, select Clinical Laboratory Improvement Amendments, or CLIA. Enter your CLIA number along with the effective date and current expiration date. Enter the address that is reflected on your CLIA certificate. To attach a copy of your CLIA certificate, open up that segment. To add the CLIA type, click Add Laboratory Certification at the bottom of the page. Select the CLIA type and enter the effective and expiration dates. If your CLIA type contains any lab codes, add the laboratory code by clicking Add Laboratory Certification again, and selecting the laboratory code from the drop-down along with the effective and expiration dates. Repeat these steps to add any additional laboratory codes. Then, click Save. To attach a copy of your CLIA certificate, click the Click Here to Select Files button at the bottom of the page. This will generate a box with a drop-down menu for the type of document that you want to add. After making the appropriate selection, click Add Attachments, and then you can select the document that you want to upload from your computer. Select the document and click Open or Save. After you have added the document, you will see the document at the bottom under Uploaded Files. Be sure to click Save at the bottom to save the document within this tab. Back on the main page for licenses, certifications, and accreditations, we see that the CLIA certificate has been added. I would like to point out under the In Use status that the CLIA is showing as not associated. This means that the CLIA is not associated to any of the programs that you are enrolled in within the Practice Location Information tab. We will look at how to associate information in this tab to your program or programs when we review the Practice Location Information tab later. Licenses, certifications, and accreditations are not required for every enrollment with an organizational NPI. If the provider type you are revalidating requires a license, you will need to confirm that it is reflected with a current expiration date within this tab. If you are unsure whether your provider type requires a license or not, reach out to TMHP for help. To update an expiration date, click the three dots to open that license segment to edit the current expiration date. Confirm that the information that is listed for the license issuer, number, and effective date is accurate. Key in the current expiration date and click Save at the bottom. If the expiration date is current, you will still want to open that license segment, confirm the information entered, and click Save at the bottom. You will then see a blue check circle on the License tab. Now let's navigate to the Disclosures tab. Here you will see yes or no questions about the organization that is applying for revalidation. Confirm that all questions are answered correctly if they already show a response. Review and answer all questions that do not have a response. After you have confirmed that all the questions have been answered correctly, scroll to the bottom and click Save. If yes was answered to any question, a pop-up box will appear, asking you to upload documents relating to that question. To get started, click OK, and select the appropriate choice from the drop-down in order to associate each attachment to a question. Then click the Click Here to Select Files button at the bottom of the page. This will generate a box with a drop-down menu for the type of document that you want to add. Choose the appropriate selection, click Add Attachments, and then you can select the document that you want to upload from your computer. Select the document and click Open or Save. After you have added the document, you will see the document at the bottom under Uploaded Files. Be sure to click Save at the bottom to save the document in the Disclosures tab. If you receive the pop-up box again, repeat these steps for any other questions answered yes, or click OK to complete the Disclosures tab. Scrolling up, we will see a blue check circle next to the Disclosures tab, indicating that it is completed. Now let's complete the Accounting Billing Information tab. Since we are submitting a revalidation request, a taxpayer identification number or TIN segment should already be displayed. To confirm or update this information, start by clicking the three dots on the right and select Open. On the left, we see that there are three tabs that need to be completed. These are the Accounting Billing, W-9, and EFT tabs. Start in the Accounting Billing tab by entering the first and last name of the billing contact within the Accounting Billing Information tab. Update or verify the address that is listed. The address that is reflected here will be the same one that is listed on your W-9. Enter a phone number and answer the question, do you have a third-party biller? A third-party biller is an entity that submits claims on your behalf. If you answered yes, complete the required fields. After entering this information, click Save at the bottom to complete this tab. The blue check circle will now be reflected on the Accounting Billing tab. If you do not have a third-party biller, answer no to this question, and click Save at the bottom to complete this tab. Let's review the W-9 tab. Start by confirming that the name listed in line 1 is correct. If you need to make any updates to this name, navigate back to the Provider Information tab and make the correction there and click Save. If applicable, enter a business name, disregarded entity name, or a doing business as name in line 2. For line 3, select the appropriate federal tax classification. If other was selected, key in the type of federal tax classification that you are listed as. Complete line 4 if it is applicable for your TIN classification. If not applicable, leave this area blank. In lines 5 and 6, confirm that the address listed is the one that is showing on your W-9. If this address needs to be corrected, navigate back to the Accounting Billing tab and make the correction there. The verified address in the Accounting Billing tab is what will be displayed here. In Part 1, confirm that the taxpayer identification number is reflected correctly, whether it's a Social Security number or the employer identification number. Make any updates as necessary. In Part 2, Certification, check the top box if it is applicable. Then, check the box that states, I attest this is what appears on my W-9. Underneath Public-Private, select whether you are a private or public entity. A public entity is one that is owned or operated by a city, state, county, or other government agency. Underneath Additional Entity Information and Attachments, select the state of the entity's formation from the drop-down. Answer whether you have a 501c3 internal revenue exemption, which is typically for nonprofits, and enter a charter number, if applicable. If PEMS is asking for a charter number, but you do not have one, enter NA in this field. Below this, upload the appropriate tax documents. For instance, if you included something in line 2 of the W-9, indicating that you do have a doing business as or DBA name, you would need to upload an assumed name certificate. Or, if you indicated that you do have a 501c3 exemption, we would need your IRS exemption letter. Depending on your tax classification, other documents may be needed. Typically, these are the following: proof of an active franchise tax account status, organizational structure chart, and your filing document from the Secretary of State. If you need help with what documents need to be attached in this section, reach out to TMHP for assistance. After confirming that all the information is entered appropriately and all the attachments are showing, click Save, and you will see the blue check circle within the W-9 tab. Now, onto the EFT or Electronic Funds Transfer tab. If you are already participating in EFT, you will still need to complete information in this tab to continue having those reimbursements deposited into your bank account. If you do not wish to participate in EFT, check the box at the top indicating, I do not wish to participate in the EFT program. After making this selection, click Save at the bottom, and this tab will now reflect a blue check circle. If you made this selection, you will receive paper checks for any services reimbursed through TMHP. If you do wish to participate in EFT, start by entering the contact information, in case TMHP needs to reach out to someone for any EFT updates. Scroll down to Agent Information, and again enter the email address that was listed under the contact information. Scroll down to Retail Pharmacy Information. If PEMS is requiring a pharmacy name, and you do not have one, enter NA in this field. Next, let's go to the Financial Institution Information. Start by entering the name of your bank, account number, routing number, and the type of account you would like the reimbursements deposited into. Then select whether you would like to associate your EFT payments to your TIN or your NPI. If you bill for several NPIs and they all share a TIN, then you can select this option. Next, enter the address of the bank that you use. This address can be their headquarters location or a branch that is closest to you. Then go to the Submission Information and select Change Enrollment for a revalidation request, and select what type of document you are going to upload. To participate in EFT, you either need to upload a voided check or a letter on bank letterhead, indicating your routing and accounting number. Ensure that the document that you upload matches the information that you entered within the Financial Institution Information area. To add your document, start by clicking Click here to select Files, and select the type of document that you are going to upload from the dropdown. Then, select the appropriate document from your computer and click Open or Save. The attachment should now be reflected at the bottom of the EFT tab. Click Save at the bottom to complete this tab. You should now see a blue check circle reflected on the EFT tab. If you have decided to participate in EFT, then you will need to sign an EFT agreement within the Agreements tab. We will be sure to cover this when we look at that tab. Next, let's navigate to the Ownership Controlling Interest tab. The yes or no questions may be reflected as answered. If they are not, answer the yes or no questions. Confirm that all questions are answered correctly. After you have confirmed that all the questions have been answered correctly, scroll to the bottom and click Save. Next, you should see a principal or principals already listed. We will need to complete information for each principal that is tied to your enrollment record. If you would like to remove a principal, click the three dots and select Delete. Then enter the relationship end date along with the reason. After clicking OK, the principal will be removed. If you are adding a principal, read the definition above this section to see who or what needs to be added as a principal to your enrollment record. To add a principal, click the Add Owner Creditor Principal button. Start by entering the Social Security number or the tax ID number of the principal that is being added. If you are not adding or removing a principal, click the three dots next to each principal to complete information for each one reflected. After opening the principal that you are completing information for or have just added, you will see 6 tabs on the left. All 6 tabs need to be completed for each principal to successfully revalidate your enrollment record. These are the basic information, addresses, healthcare licenses, certifications, accreditations, employment information, relationship information, and disclosures tabs. We will start with the Basic Information tab. Ensure that the principal's information is listed appropriately, and make any necessary updates. For instance, if the ID type is reflected as expired, key in a current expiration date and click Save. For a new principal, enter all the fields as indicated. After clicking Save, navigate to the Addresses tab. If the physical address has not changed, click Verify Address. If the physical address has changed, make the appropriate update, and then click Verify Address. If the accounting billing address is the same as the physical address, check the box that indicates Same as Physical Address. If the address is different, enter the accounting billing address and then click Verify Address. After doing this, click Save at the bottom to complete the Addresses tab. Next, let's look at the Healthcare Licenses, Certifications, Accreditations tab. Answer the yes or no question. Do you have a professional license? If no is answered, click Save to complete this tab. If the principal does have a license, certification, or accreditation, check Yes. And then click the Add Healthcare Licenses, Certifications, or Accreditations button. Key in all the required fields as indicated with a red asterisk. And then click Save at the bottom. This will take you back to the Healthcare Licenses, Certifications, Accreditations tab. Click Save once more at the bottom to complete this tab. If a license is already reflected and the expiration date needs to be updated, click the three dots. Update the expiration date and click Save at the bottom. This will take you back to the Healthcare Licenses, Certifications, Accreditations tab. Click Save once more at the bottom to complete this tab after you have updated the expiration date. Let's now go to the Employment Information tab. Enter the title of the principal along with their duties. Underneath your role in the provider organization, make the appropriate choice within the dropdown. Then enter the role effective start date. Below this, answer the yes or no question indicating whether you have employment history with a separate provider. If yes is checked, enter the information for this previous employer. This would be the NPI provider name, address, and the start date. Then click Save at the bottom to complete this tab. If no is answered for the Do you have employment history with a separate provider question, click Save, and this will complete the tab. Next, go to the Relationship Information tab and answer the yes or no question. Do you have a relationship with a separate provider? This is asking whether you have any contractual relationship with another provider. For instance, let's say you are a clinic group practice that is referring a client to a specialist down the street. If you and this specialist have a contractual agreement that you will be sending clients to them, you will need to answer yes and enter their information after answering this question. Then click Save to complete this tab. If you do not have a contractual relationship with another provider, click No, and then click Save at the bottom to complete this tab. Lastly, we will go to the Disclosures tab. Within this tab, read and answer the yes or no questions for the principal that you are confirming or have added. Remember, these questions are specific to the principal and not the organization. After you have confirmed that all questions have been answered correctly, scroll to the very bottom and click Save. A pop-up box will appear. If the only question that was answered yes is the Are you a citizen of the United States question, click OK to complete this tab. If no was answered for this question, provide the country of which the principal is a citizen and click OK. If you need to upload documents for any other questions, be sure to follow the same steps that we looked at when reviewing the W9 tab. Click the Back button in the blue header to get back to the Ownership Controlling Interest tab. Be sure to complete the 6 tabs for any other principals listed. Once all information has been completed, scroll to the very bottom of this tab to add the Authorized Signatory. The Authorized Signatory is a principal that you have designated to electronically sign your agreements. Start by clicking the Add Authorized Signatory button. Then select one of your principals from the drop-down and enter the email address for this principal. The email address entered here will be where the agreements are sent once they are initiated. The authorized signatory will need to be the one to sign both the HHSC agreement and the EFT agreement if you have decided to participate in EFT. After adding an authorized signatory, click Save Changes, and then Save at the bottom to complete the Ownership Controlling Interest tab. A blue check circle should now be reflected on this tab. Now let's navigate to the Programs tab on the left. The program or programs that you are already enrolled in should be checked Yes here. If you wish to add a program, select Yes to that program. Select No for any program that you do not want to enroll in. Then click Save at the bottom. For a revalidation request, you can add additional programs. If you click Yes to add a program that was not already reflected in your enrollment record, you will need to add the program to one of your practice locations to avoid any deficiencies. We will review how to do this when we go over the Practice Location Information tab next. For today's example, we will add the long-term care program to our enrollment record by clicking Yes next to this program. After clicking Save at the bottom, we will see the blue check circle on this tab. Next, let's navigate to the Practice Location Information tab. Here you will see the practice locations that are tied to your enrollment record. Every location that is listed needs to have information confirmed or updated. With a revalidation request, you can add practice locations, but your request would then need to go to HHSC for their screening process. To do this, click the Add Practice Location button. Then, within the drop-down for Please select the type of location. Choose whether you are adding a group or a facility. To revalidate a practice location, start by clicking the 3 dots on the right and select Open. Now we will see 5 tabs on the left. These are the Basic Information, Programs and Services Participation, Demographics, Managing Employees, and Mailing Contact Addresses tab. We will need to confirm the information in each tab for each practice location. Start with the Basic Information tab. For an address update, enter the new address and click Verify Address. If you are revalidating an existing location, confirm that the address is correct and click Verify Address. If the address is not verifying in our system, but is valid, click Continue with Address entered. Enter the phone number for that practice location or confirm that the number is listed accurately. The phone number entered here will be the one listed in the Online Provider Lookup, or OPL. After all fields are completed, click Save at the bottom to complete this tab. Now click on the Programs and Services Participation tab on the left. Before we complete the program details, I would like to point out that this is where you would include surety bond information if your provider type requires it. Do not enter anything here if your provider type does not require a surety bond. If your provider type does require one, enter or update the surety bond information here at the bottom of this tab and click Save. If you are adding a surety bond, you will need to include a copy of this in the Attachments tab. We will review this tab later in the demonstration. In this example, we see that only one program is associated to the practice location that we are revalidating. Start by clicking the three dots on the right of the program and select Open. At the top, we see that the program we are revalidating is displayed. Below this is a question. Do you wish to end your participation? If you would like to disenroll your current program from Texas Medicaid, answer yes to this question and select a reason from the drop-down. To revalidate the program, make sure the question is answered no. Under the Status Codes field, you will see codes, along with the reason why an enrollment record is not active. Here we can see an active status code that would prevent reimbursement because the surety bond is expired. After updating the surety bond information and submitting the request, this code will be removed. Within the program's details, fields will need to be updated or confirmed. Since this location has the same address as the CLIA that we added, we will associate the CLIA to a program within this practice location. We will do that by clicking the Association License Certifications and Accreditation button. To add the CLIA certificate, select it from the drop-down. We now see that the CLIA certificate is associated to the program. Scroll down and confirm the demographics for your clients. Start by selecting any gender limitations and any patient age limitations. For this, begin by selecting the age you will start seeing patients, and then select the age where you will stop seeing patients. Also select whether you are accepting new patients. For this demonstration, we will select all for the gender limitations, 0 as the patient start age, 18 as the patient end age, and that we are accepting new patients. Next, confirm that the appropriate tax ID number is associated to the program. Scroll down and confirm the Medicare information if the program reflects the question about Medicare. Confirm that your Medicare number and effective date are accurate to avoid any unnecessary deficiencies. If the organization does not participate in Medicare, select No for the Medicare question and check the top box indicating that you will not provide services to Medicare-eligible clients. Below this, select one of the two choices underneath Medicare waiver requests. After making a selection, explain and justify your reason for making a Medicare waiver request in the box below. For this example, we will use a Medicare number to associate to our program within the practice location that we are revalidating. Scroll down and answer the yes or no questions. You may have a Healthy Texas Women or HTW question, depending on your provider type. If your provider type participates in this program, click Yes to this question. Be sure to add an HTW attestation in the Licenses Certifications Accreditations tab and associate it to your program, as we reviewed when adding our CLIA certificate. If you see this question and you do not wish to participate in HTW, then select No. After all the information within the program has been entered or confirmed, click Save at the bottom to complete that program. Navigating back to the Programs and Services Participation tab, we will add the long-term care program to our enrollment record since we checked Yes for this program in the Programs tab. Start by clicking Add Program and Service Participation. Then from the drop-down, select Long-Term Care Services. Choose the taxonomy and provider type that you are adding. For today, we will add the Community Living Assistance and Support Services or class provider type to our enrollment record. Complete the rest of the required fields within the Program Details tab, and click Save at the bottom to add the program. If we go back to the Program and Services Participation tab, we will see that the long-term care program has been added with a status of pending enrollment. The next tab that we will complete for the practice location that you are revalidating is the Demographics tab. If information is already displayed, confirm that it is accurate or make any necessary updates. For instance, you can add a county or update your office hours. If the hours are the same for multiple days, complete the hours for one day. Then click Apply All on the right. This will make the hours the same throughout the week. Edit any days where office hours are different, or check Closed for any days where you are not seeing clients. Then click Save at the bottom. Scrolling up, we will now see a blue check circle indicating that the Demographics tab has been completed. Next, let's complete the Managing Employees tab on the left. To add a managing employee, click the Add Managing Employee Association button at the bottom. Then from the drop-down for a selected employee, choose one of the principals that you entered in the Ownership Controlling Interest tab, that is, the managing employee for that practice location. Then select the managing employee's role from the drop-down. Lastly, enter the start date at the location for the managing employee. Once all these fields are completed, click Save at the bottom to complete this tab. When revalidating, you may already see a managing employee listed. If so, click the three dots and select Edit. Confirm that the information displayed is accurate and that a managing employee for the practice location that you are completing the revalidation for is reflected. After confirming or updating this information, click Save at the bottom to complete this tab. We will now see a blue check circle indicating that the Managing Employees tab has been completed. Now let's complete the Mailing Contact Addresses tab. Start by clicking the three dots on the right and then select Edit. Confirm that the address listed is an accurate mailing address and click Verify Address, or make any updates as necessary. Below this, enter the phone number for the person who is handling the enrollment request. This number will not be displayed to the public and is only used when our provider enrollment department needs to contact your organization to provide education on how to correct a deficiency. Select the contact type for the person who is handling the enrollment, along with their email address and their first and last name. Click Save at the bottom to complete this tab. Since we added the LTC program to our enrollment record, we will need to add two mailing segments. One that is a mailing segment, and one that is a contact address. Now that both mailing segments are showing, we will click the Back button in the blue header to return to the main PEMS page. Attachments are not always required for an organization's revalidation. However, if you would like to upload any attachments, like a surety bond, which we discussed earlier, click this tab and again click here to select Files. Upload the appropriate document from your computer. After confirming that the document or documents are attached, navigate to the Agreements tab on the left to complete the request. On the Agreements page, you will need to initiate the HHSC Enrollment Agreement, which will need to be electronically signed or e-signed before you can submit your request. The HHSC agreement is a contract between the provider and the Texas Health and Human Services Commission. The authorized signatory is not always the person who is completing the application. However, to remain in compliance, the enrolling provider does need to be the one to sign the HHSC agreement. To begin this process, click the three dots on the right and choose Select Authorized Signatory. The email address that is displayed is the one that was entered in the Ownership Controlling Interest tab. If corrections need to be made to the person or email address, navigate back to the Ownership Controlling Interest tab to correct this information. Click Activate Agreement. Here we see that the status of the agreement is Sent. The agreement has been sent to the email listed. To e-sign the agreement, go to that email and click the link. This will open a window requesting a password to access the HHSC agreement. The password for an organizational revalidation request is the last four digits of the Social Security number for the principal you added as an authorized signatory in the Ownership Controlling Interest tab. Enter this number and click Continue. To begin e-signing, click Continue at the bottom of the agreement. If you don't see the Continue button, use the yellow flags on the left to navigate to the portion of the agreement that needs to be e-signed. Where it says Click here to sign, click and type the authorized signatory's name. Here we have a common deficiency that can be easily avoided. Do not use abbreviations of names, nicknames, or titles when signing the agreement. If the name entered does not match the name of the authorized signatory in the Ownership Controlling Interest tab, a deficiency will be issued. Then you will need to correct the signature and resubmit the application before the revalidation request is approved. After typing in the authorized signatory's name, click Apply. To complete e-signing the HHSC agreement, click the blue Click to Sign button at the bottom. A message will display, indicating that you have finished signing the enrollment agreement. Repeat these steps to sign the EFT agreement if you have chosen to participate in this. Back in the Agreements tab, click the three dots for the EFT agreement. Select the authorized signatory and email address, access the email, enter the last four digits of the authorized signatory's Social Security number, and use the yellow ribbons to navigate to the area to e-sign. be sure to confirm that the information within the EFT agreement is accurate. If it is not, navigate back to the EFT tab within the Accounting Billing Information tab, make the appropriate updates and save. Then go back to the Agreements page to initiate a new EFT agreement to e-sign. Once you have received the message that the EFT agreement has been successfully signed, navigate back to the PEMS application by selecting that tab or window in your internet browser. Back on the Agreements page, we are looking for the status to update from sent to signed. Once this status is updated, a Submit button will populate at the bottom of the agreement. It may take some time for the agreement to populate as being signed. If it is taking a while for the agreement to reflect as signed, leave the request, and then come back later. Here we see the status is updated from sent to signed, and that we have our Submit button reflected at the bottom. Keep in mind that after clicking Submit, you will not be able to make any updates or changes to your revalidation request. PEMS will run a deficiency check before the request can be submitted. If any deficiencies are reflected, you will see a red circle indicating which tab needs to be completed or fixed before the request can be submitted. For instance, if your provider type requires an application fee, you will see a red circle in this tab. Open that tab and select one of the three radio buttons. These will be 1. You'll need to pay the application fee. For this selection, be sure to click the hyperlink shown to print out the application fee cover letter. Be sure to include the cover letter when you mail in the check, money order, or cashier's check. This is how our provider enrollment department will know which enrollment request the application fee needs to be associated with. 2. You have already paid the fee to Medicare, another state's Medicaid program, or the CHIP program. If you have made this selection, be sure that your proof of payment is attached to the application at the bottom of this tab. 3. You are requesting an application fee waiver. For this one, you will need to submit supporting documentation in the form of a letter that lists the details on why you cannot pay the fee. This information will be reviewed by HHSC, who will make the decision on whether to waive the fee for your enrollment request or not. If you see any other deficiencies, go into that tab, make the appropriate corrections, and then navigate back to the Agreements tab and click Submit again. A message will display indicating that the request has been successfully submitted. Click OK, and then click the Back button in the blue header to return to the PEMS dashboard. Click Requests in the upper left corner to verify the status of the request that you just submitted. You can search for the request by entering the request number in the upper right corner or by searching for the NPI you submitted the revalidation request for. As the application moves through its various stages of processing, the status will update. The only time you need to respond is when the status is indicating pending provider response. This means that our provider enrollment department has identified a deficiency within your revalidation request. You will need to open the request by clicking the three dots and navigating to the area where the deficiency was identified. This will be indicated with a red circle. Once you have successfully made the corrections, go back to the Agreements tab and click Submit. This will put the application back into a status where provider enrollment will verify that the correction has been made and continue processing the request. Once you have completed your revalidation, you will be given a new revalidation date. Typically, these are 5 years from the date of revalidation. However, due to Texas regulations, the time frame could be shorter than this. Thank you very much for your time today. Hopefully, you have found this video helpful.